Hi, everybody. This is Dr. Britt Talley Daniel, MD, and I'm dictating another migraine podcast here. The subject today is migraine triggers. So, migraine is a genetic condition that's inherited through your DNA. The genes that transmit migraine have been found and published in the medical literature. Migraine occurs in 25% of women and 6% of men. For women, migraine is their most common chronic medical problem and more prevalent than diabetes, heart disease, or arthritis. Migraine is one of the main causes of disability worldwide in men and women. Migraine causes more than 1 million emergency room visits every year. Now, an attack of migraine could last 4 to 72 hours and may be called episodic migraine if it occurs less than 14 days per month, or chronic migraine if more than 15 headache days a month occur, 8 of which have migraine features. Researchers have discovered what they call migraine triggers, which may set off an attack within 24 hours or so. Aggregating features are more chronic occurring factors lasting weeks and months that may set off a migraine headache. So I'm going to list these first, and I'll go back and discuss them individually. So common migraine triggers are stress and nervous excitement, or freedom from stress, which goes by the names of the letdown, weekend, or holiday headache. Menstruation with fluctuating estrogen levels, elevated estrogen level from birth control pills or treatment of menopausal women, hypoglycemia from fasting, barometric weather change, motion sickness, mountain sickness or decompression illness, insomnia, oversleeping or long napping, nocturnal end of a dream headache, fragrances, flashing, flickering or fluorescent lights, dietary factors, heat or sun or workout headache, intercourse, orgasmic headache, overuse of analgesics, head injury, concussion, post-concussion headache, fever, caffeine withdrawal, wine, beer, alcohol, or hangover headache, brain freeze, ice cream headache, toothache, grinding with TMJ syndrome, prolonged overexertion. Okay, now I'm going to give a discussion of the individual issues. The first is stress and nervous excitement. Stress is always the number one driver of migraine. And studies have been done looking at migraine triggers. Stress is always at the top. Now, stress is outside pressure in life, work, or family that's upsetting. Humans use mental mechanisms of denial, projection, suppression to deal with unsettling situations. But the stress could be working 2 extra hours a day, caring for a sick child or family member, inter-office conflict, monetary pressure, an overbearing critical boss, or many other things. Whatever it may be, the stressful event occupies our minds, and if unhealthy, we brood or bury it, and we don't talk about it. If we are healthier, we discuss the problem with our spouse, co-worker, friend, family member, priest, rabbi, or preacher. We get it out and deal with it. Then we feel better, and we find a way to make it through. Stress can cause acute nervous excitement, sometimes with symptoms from altered normal physiology of our bodies like rapid heartbeat, trembling hands, and trouble breathing that may come with a panic attack. Whatever the stress is, it can set off migraine headaches. Number 2, freedom from stress, letdown, weekend, holiday headaches. Some people reliably get a migraine, not at the time of stress, but when they're free of stress. Example of this may be the so-called letdown migraine that occurs after completing final exams at school. Our mother finally finishes everything she must do on Thanksgiving to buy and prepare the turkey and fix up her home for 14 family members. She sits down. later, puts her feet up, and soon an awful migraine starts in her left temple. Part of this may be caused by withdrawal from the constant vasoconstrictive effect of the stress hormone adrenaline. Contracted arteries are suddenly released into vasodilatation, and a severe migraine starts. Number 3, menstruation with fluctuating estrogen levels. Living, he's a writer, Living, who's a great British cataloger and writer of migraine in the late 18th century, described what was called catamenial menstrual-related migraine in 1873. It's known that about 60 to 70% of women with migraine develop a migraine around the end of their third week of their cycle when estrogen levels fall. This is called menstrually related migraine without aura. 30% of women have no menstrual cycle-related migraine. The first 6 months of pregnancy are a high estrogen level for mothers, and migraines rarely come then, especially for estrogen reactors. It's not well understood exactly how falling levels of estrogen produce migraine, but it's well documented that it does. Number 4, elevated estrogen levels from birth control pills or treatment postmenopausal women with patch or a shot. The FDA has warned that all estrogen-based birth control pills are contraindicated with migraine. That's a phrase that means they shouldn't be taken with migraine. And doctors, like OB general doctors, internists, should always find out if their patient has migraine before they give an estrogen treatment. This means they shouldn't be taken by migraineurs. Also, postmenopausal women may develop more frequent and severe migraines taking estrogen. And the general rule here is that fluctuating levels of estrogen, such as occurs with the normal menstrual cycle of 3 weeks of estrogen, then a week of progesterone, or estrogen levels that are too high, may worsen migraine. Number 5, hypoglycemia, low blood sugar from fasting. It's well accepted that fasting can produce a migraine attack in persons with migraine. Living, again, described fasting as an aggravating factor for migraine in 1873. Everybody gets hypoglycemia if they don't eat. Your car won't go if it doesn't have any gas either. Breakfast means break the fasting of sleep. And how many migraine patients and women I've seen in my time practicing 50 years in neurology, women that don't eat breakfast, or girls don't eat breakfast. Migraine patients should eat 3 meals a day and carry extra snacks or power bars if they get hungry. Number 6, barometric pressure change. Migraine patients commonly report, when seen back on regular visits, about the effect of weather change or cold fronts or barometric pressure aggravating their headaches. It's very common and well documented. I hear it all the time. It's like persons sometimes say they can, quote, feel a storm coming, end of quote, in their bones. Living, again, reported the influence of the atmosphere on migraine in his big book on migraine in 1873. It may be due to the pressure difference between the atmosphere and air-filled sinuses. I never learned about barometric pressure sensors in the brain while studying neuroanatomy. Some say the reaction comes from barometric sensors in the carotid arteries, or traction on cranial dural veins, or cranial sinuses. Exactly what causes this is not certain. Certain barometric changes set off migraine headaches. It happens with mountain sickness, scuba diving, high altitude jet travel, decompression illness, altitude changes, and with dry wind sweeping down from the mountains. A study in the Journal of Internal Medicine article reported on migraine patients who kept a headache diary for 1 year. After in comparing these diaries with the barometric pressure changes, there was a notation of a nearby weather station, a direct correlation between lower atmospheric pressure and the onset and duration of migraine attacks. The report concluded that, quote, barometric pressure change can be one of the exacerbating factors of migraine headaches, period, end of quote. Prince et al., writing in 2004 in the Headache Journal on, quote, the effect of weather on headache, end of quote, on 77 patients in a migraine clinic. 39, or 5.6%, were found to be sensitive to weather but 48 or 62% thought they were sensitive. The authors concluded, our study supports the influence of weather variables on headache. We showed that patients are susceptible to multiple weather variables and that more patients thought weather was a trigger than was the case. I instruct patients to monitor barometric pressure daily on their cell phones because the data is available there, or on their computer, and then treat early with a triptan at the onset of the headache, sometimes even before the migraine starts, if they usually get an attack with pressure change. So again, the idea is track the atmospheric pressure when it drops or goes down, then start treating. And the best treatment at onset currently is to take a triptan at onset for migraine. Number 7, motion sickness. Motion sickness is also comorbid 60% with migraine. Motion sickness is car sickness when a child, inability to read in the car, especially in the back seat, gets air sickness or seasickness. Migraine inflames all the sensory cranial nerves, and the 8th cranial nerve carries audition and motion sensitivity from the inner ear into the brain. The migraine process inflames this nerve. Many patients with an acute migraine get car sick when driving, which may not bother when they don't have a migraine headache. A new classification of migraine from the International Classification of Headache Disorders is vestibular migraine. This may be attacks of vertigo with or without migraine headache at the same time that come with nausea, vomiting, and prostration. The word vertigo comes from the Latin meaning to turn or spin. In its broadest application, vertigo may mean perception of movement of the environment by an affected patient. As an ex-Navy neurologist, I know that the U.S. Navy has a medical restriction regarding motion sickness that may drive an unfortunate, promising, and willing recruit to a medical board for dismissal. Reason would imply that motion sickness is potentially a medical limiting problem for any unfortunate sailor. Motion sickness can be experienced riding in a car, while reading in a car, in a boat, or on an airplane. Migraine patients get motion sickness more than the normal population, and the existence of motion sickness is often queried on headache history inventories in the office by the neurologist. Patients with motion sickness report symptoms also at the fair, on whirling rides or roller coasters. Sometimes after the motion-induced vertigo, nausea, the patient with motion sickness will get a headache as a migraine may be activated by that experience. So gradually they learn to avoid such rides. They know they can't read in the car, and it's better to drive or sit in the front seat, and with time they just adjust to the problem. Number 8, insomnia. Poor sleeping habits have a powerful effect on migraine headaches. Insomnia is a core diagnostic feature of depression, which is 50% comorbid with migraine, and with generalized anxiety disorder, abbreviated GAD, which is 40% comorbid with migraine. Using an electroencephalogram, or EEG, sleep has 4 stages, with stage 1 being light sleep and stage 4 being deep sleep. All the sleep studies on migraine patients find that they only get to light stage 1 or 2 sleep. So trouble sleeping could be taking a long time to fall asleep, or trouble staying asleep, or sometimes both problems. During dreaming, rapid eye movement, called REM, R-E-M, rapid eye movement sleep occurs, and migraine patients may experience an end of the dream wake-up migraine headache. Migraine patients also may have early morning wake-up headaches. Oversleeping on a non-working Saturday or Sunday morning may also trigger a migraine. Fragrances. Migraine inflames all the brain sensory nerves, and the olfactory nerve is the first of 12 cranial nerves. The odors or fragrances that aggravate migraine are cigarette or cigar smoke, perfumes, paint, and mildew. This is called osmophobia also, and migraine patients generally have very sensitive brains. Kelman, a neurologist writing in on osmophobia and taste abnormality in a large 727 group of migraine patients, reported osmophobia and taste abnormality problems occurred in one quarter of migraineurs during an acute migraine, while perfume and odor trigger migraine in almost half of patients. Osmophobia and taste abnormally in the acute migraine attack, as well as perfumes or odor as a migraine trigger, are more common in females than in males. I have a story there. One time I was checking into a hotel in New York with my family. My wife has migraine, very sensitive to cigarette smoke. We always asked the front desk to get a non-smoking room. We walked in, this room smelled out smoke. I couldn't smell it, but my wife noted it, and I went immediately to the phone and asked for another room. I did not want to inflict that on her, nor live with her during the time I had a migraine in the hotel. Number 11, flashing, flickering, fluorescent lights. Sensitivity to light or photophobia is one of the necessary diagnostic features of migraine according to the International Classification of Headache Disorders. Many different types of light may aggravate the sensitive brain of a migraine patient. Patients may state that they have experienced the start of migraine after seeing light glance off the shiny chrome of a car off of water. Others may state that their migraine started after watching the sunshine through lines of trees while driving. I've heard that several times. Migraine patients go to bars with their loud rock music and flashing strobe lights may get a headache. Fluorescent lights will flicker when they're turned on, particularly if they're old or need to be replaced. If this light is located in the workplace, it may aggravate certain sensitive migraine patients. I've written notes for patients in the office to get to their boss requesting these fluorescent lights be replaced. I've also had some patients who wore dark glasses at work because they couldn't get the light changed in that work environment. Many migraine patients wear hats with bills or sunglasses when outside. They avoid the light. Number 12, fever. Someone with fever has a flushed red face. In this condition, all the superficial arteries in the skin of the face are vasodilated. During an attack of migraine, the cranial arteries are also dilated. Persons without migraine may get a vasodilating headache with fever, but migraine patients are more commonly affected and may have an actual migraine at that time. 13, dietary factors. This is a complicated, controversial subject in the migraine literature. I have a list of possible foods that may aggravate migraine on my webpage at www.drmigraine.com under the general migraine category, with a chapter in migraine called Migraine Aggravating Features. The usual foods discussed are hot dogs, foods with monosodium glutamate, MSG, chocolate, and yellow cheeses. 14. Heat, sun, workout headaches. The relationship of heat, the sun, and working out with migraine has not been studied statistically, but mostly surveys of migraine patients mention it. None of the headache textbooks I consulted discussed it, but it's all over the internet if one Googles migraine and heat or migraine and the sun. Consider that exposure to heat, sun, or working out makes the individual red in the face or somewhat flushed. All the tiny blood vessels in the face are vasodilated following exposure to heat, the sun, or working out. And the same thing happens inside the skull to the cerebral arteries. Cerebral vasodilatation and trigeminal activation are the heart of migraine attacks and clues to our understanding what's going on in the brain with the headaches. There may also be more subtle changes in the brain from small increases in core body temperature also, which promotes migraine. 15. Intercourse or orgasmic-related headaches. The occurrence of a sudden, quick, high-intensity onset to peak level headache with orgasm is a well-known and reported occurrence with migraine. These headaches have been described as they come on in seconds like a flash, like a bolt from the blue, like I was hit in the head with a hammer. After neurologic workup, these headaches are usually considered benign. Hippocrates described headache from what he called immoderate venery. Venery is excessive sexual activity. Napoleon's wife reportedly stated, quote, "Not tonight, I have a headache," period, end of quote. This is a common, somewhat humorous cliche reflecting the socially assumed but inaccurate gender differences in sex drive and the perceived role of women regarding controlling and sometimes avoiding sexual activity which exists in our modern culture. Lance, a famous Australian headache neurologist, first wrote about sex and headache in 1969 in his article called Coital Cephalgia. Lance later stated, and I think this is very humorous and cute of him, since foods and wines are often incriminated as sources of headache, it seemed only a matter of time before sexual intercourse was added to the list of pleasurable activities which may be responsible for headache, the most common of killjoys. However, Couch and Beers reported in 1987 that some individuals have noted relief from migraine headache with sexual activity and orgasm. So go figure. It goes both ways. For a thorough discussion of this subject, go to Chapter 12 in my book, Migraine. ICD-HD calls this primary headache associated with sexual activity. 15. Overuse of analgesics. This is the most common reason for a headache patient to see a headache doctor. The syndrome was first called a rebound headache, and a basketball term indicating return of a headache after initial successful treatment. This is now called medication-induced headache and affects 3 to 4% of the world population. The International Classification of Headache Disorder says taking triptans, over-the-counter drugs, which are caffeine, Tylenol, Advil, or naproxen, over 15 days a month, or opiate narcotics or barbiturate drugs more than 10 days a month, may produce chronic migraine. Now, chronic migraine is defined as 15 or more headache days a month, 8 of which have migraine features. I have a thorough discussion of medication-induced headache in my textbook on migraine, Chapter 5. Head injury, concussion, post-concussion, number 16. All the following entities may worsen migraine: a mild non-concussive head injury for several days, concussion for weeks to a month, and post-concussion syndrome for several months. None of the injuries cause headache every day for a long time, like a year without medication over-treatment. The doctor and the patient must be careful with the judicious use of treatment for headache in this situation. Opiate narcotics and butalbital have no place here for treatment after a head injury. Caution also must be used with over-the-counter drugs like caffeine, Tylenol, Advil, or Aleve, because they can produce daily headache like medication-induced headache. In general, patients with head injury should be scanned in the ER with a CT, seen by a doctor, and examined. Head injuries may release neurochemicals into the brain that aggravate headache. And there's a head injury migraine syndrome called post-traumatic migraine. 17. Caffeine withdrawal. Caffeine is the most commonly used over-the-counter vasoactive drug in the world, used to treat headache. The popular soft drink Coca-Cola was invented by pharmacists for the purpose of treating headache. Caffeine has been combined with aspirin as Excedrin for treatment of migraine, and it's all that a number of mild migraine patients need to get rid of their headache. In recent years, the Starbucks chain has placed their ubiquitous logo in coffee houses all over America, selling very high caffeine content coffee, which has moved the American caffeine addiction problem to higher levels. Like a 550 milligram grande Starbucks has 550 milligrams of caffeine in it, while a regular cup of Folgers is like 130 milligrams of caffeine. Medical articles declaring addiction to caffeine and predictable withdrawal symptoms following cessation occurred in the early 1990s, and probably influenced the inclusion of caffeine as an addictive drug in the 1994 edition of the Diagnostical Manual for the American Psychiatry Association's fourth Diagnostic Statistical Manual. Pharmacologically, caffeine acts as a central nervous system stimulator, a point that's well made by the coffee ad on TV, which calls it a think drink. The duration of effect of the drug is 4 to 6 hours. This means if one goes to bed at 11 p.m., then the last drink of coffee should be no later than about 3 p.m. so that caffeine doesn't affect sleep, although many persons will sleep okay with no caffeine, or better with no caffeine at all. Caffeine also acts as a constrictor of the smooth muscle found in arteries, the bladder, and the colon. It's the arterial vasoconstriction action of Excedrin which helps mild migraine and may lead to medication-induced headache when one withdraws from caffeine or takes too much caffeine. The smooth muscle effect also acts as a mild stimulant on the bladder, producing urination, and on the colon, producing a bowel movement. Withdrawal symptoms are of caffeine overuse, headache, fatigue, restlessness, nervousness, insomnia, exhaustion, and psychomotor agitation, and that may last 2 to 4 weeks. I also have an article on that entitled Caffeine is a Drug and How Caffeine May Worsen Migraine at my blog site. Number 18, wine, beer, alcohol, hangover, headache. Paulus Aegineta in the 7th century described migraine from, quote, drinking of wine. Gallagher, writing in Headache in 1988 on diet and migraine, stated, alcohol is a nonspecific vasodilator that's sought to provoke migraine attacks in susceptible persons by depressing or altering the function of central vasomotor centers, since the direct effect of alcohol on blood pressure and blood vessels is insignificant. Of all the known precipitating agents, alcohol is the most consistent provoker of headache in the largest number of migraine patients, end quote. As time has gone on and more research has been done, the relationship of alcohol to headache has become more complicated. Alcohol may cause an immediate headache, like 30 minutes after drinking a glass of red wine, or a delayed headache called a hangover that comes the next morning. Some persons drink to excess to have the next morning hangover, while the migraine patient may awaken with a headache following only a small amount of alcohol. See my blog article on Is Alcohol a Migraine Trigger on my webpage, and the chapter in Migraine on Migraine Aggravating Events. 19. Brain freeze, ice cream headache. Raskin wrote that the most common cause of head pain is ice cream, occurring in 1/3 of a randomly selected population. Most people are familiar with this problem. They eat something very cold, and when that cold substance touches the roof of their palate, many times and very soon they experience an intense, dagger-like pain extending from the palate into the throat through the head that stops them from doing anything for a few moments. It's disabling. Houlihan, in his 1997 British Medical Journal editorial in 1997 entitled Ice Cream Headache, said no need for abstinence. He described the problem as follows. The pain begins a few seconds after the rapid ingestion of cold foods or beverages and peaks in 30 to 60 seconds. The pain is usually located in the midfrontal area, but can be unilateral in the temporal, frontal, or retroorbital region. It's a stabbing or aching type of pain. It recedes in 10 to 20 seconds after its onset. Rarely it persists for 2 to 5 minutes. The cold substance, which could be Rocky Road ice cream or a 7-Eleven slushie, provokes the sensitive temperature fibers of the second maxillary division of the trigeminal nerve and the glossopharyngeal nerve in the throat, so that certain persons develop this predictable, short-lived, but disturbing experience. Pain and temperature fibers travel together through the same neuronal pathway, and then cold can become pain very quickly. The question is whether many normal non-migraineurs get brain freeze headache or if it's just a specific migraine trigger. As with many modern myths that are carefully studied, the devil is in the statistic. My migraine book has more to say about this. No treatment is usually required, and the sufferers rarely seek medical attention, since the posterior aspect of the palate is most likely to reduce the referred pain of ice cream headache. Avoiding contact of the cold food with this area can effectively eliminate the symptoms. Most people arrive at such preventive measures without advice of doctors, but ice cream abstinence is not indicated. Because you know how it goes, I scream, we scream, we all scream for ice cream. 20. Toothache, grinding with TMJ syndrome. All teeth and the temporomandibular joint, TMJ, are innervated by the trigeminal nerve. Pain from dental or joint disease can aggravate brain pathways that lead to migraine. Prolonged overexertion. 21. Overexertion turns on the autonomic nervous system and the pituitary adrenal system, much like stress or the fight and flight response. Cerebral neurochemicals are produced also. The problem for the patient is that their bodies do all these things naturally without their will, so that when the exertion is over, the patient collapses and tries to get some rest. Subsequent withdrawal of adrenaline or cerebral neurochemicals can produce a so-called let down, headache at a time of rest following exertion. This may be a weekend, a vacation to the beach, the end of school when the kids are out, or the downside migraine attack that follows a major national or religious holiday like Christmas or Thanksgiving. Related questions. Which of the list of triggers are the most aggravating factors? It depends upon time and which one would result in a migraine within 24 hours or following accumulation of problems. Triggers would be menstruation, hypoglycemia, barometric weather change, motion sickness, mountain sickness, oversleeping, end of the dream headache, fragrances, flashing light, dietary factors, heat, orgasm, head injury, fever, caffeine withdrawal, alcohol, brain freeze, and toothache. Where aggravating factors would be stress, freedom from stress, elevated estrogen levels, insomnia, overuse of analgesics, and overexertion. So, I hope this has been helpful. This discussion of migraine triggers. All your migraine patients, God bless you. I'm sorry you have it. Please avoid all your triggers. Be sure to register for this podcast, please. And I'll see you again on the next visit. God bless you all.